Hi everybody, I'm Renee Miller. I'm a doctor of physical therapy and I specialize in abdominal and pelvic conditions. And I'm also an instructor of Pom Squad fitness classes. I'm Captain Renegade. So as you know, Pom Squad Fitness is running a month of self-love and self-care promotions. So I wanted to share a topic near and dear to my heart, self-care for your pelvic floor. So how is this relevant to Pom Squad Fitness? Well, I would bet many of you are peeing a little bit during Pom Squad Fitness classes. In Pom Squad, we do prancing, we do jumping, there's jumping jacks, there's kicks, and all of those activities can cause a little stress urinary incontinence for some people. And that's what I want to talk about today. What is your pelvic floor? What is stress urinary incontinence, and what can you do about it? Okay, so what is your pelvic floor? Well, everyone, humans, have a pelvic floor, male and female. Basically, it's a group of muscles that run from bony structure to bony structure, ischial tuberosity to ischial tuberosity, pubis to tailbone, and it's a group of muscles that has 3 layers. The more superficial layers here work to hold back urine, hold back gas and stool, and close the vaginal opening. Obviously, males, different story. The deeper layer of pelvic floor muscles is called the levator ani group, and it's more about support. So our pelvic floor muscles have in physical therapy, we talk about 5 basic functions. One, like I mentioned, is support. So our pelvic floor muscles support our pelvic floor organs or our pelvic organs. That would be in the female pelvis, your bladder, uterus, and rectum. In the male pelvis, that would be your bladder, prostate, and rectum. The pelvic floor muscles also provide stability. So they stabilize our bony pelvis. So maybe you've seen people who one hip is higher or one hip's more forward. That is how our pelvic floor should be helping us to stay stable, balanced, and even. Our pelvic floor muscles also have a sphincteric role. You've probably heard of your anal sphincter before. You also have urethral sphincters. Sphincters are muscles that are at rest, tonic, so they are contracted. And when it's time to empty the bladder or empty the bowel, they relax a little bit, let things pass by, then they contract again. So they have a sphincteric role. Our pelvic floor muscles are important in our sexual function. So when we are aroused and having an orgasm, our pelvic floor muscles contract and relax rapidly for a short time. And that's part of what gives us a strong, healthy orgasm. Also in men, it also contributes to ejaculation. And we also have a sump pump quality from our pelvic floor muscles. So during arousal, for example, more blood flow rushes to the pelvis. And after intercourse or an orgasm, hopefully an orgasm, our body needs to clear out that blood flow. So by contracting and relaxing these muscles, it will help clear the veins of the pelvis and also the lymphatic vessels of the pelvis. Little plug for that dry brushing video. We have a lot of lymphatic vessels and lymph nodes in our groin and our pelvis, and these muscles help clear that. Dry brushing helps too. Okay, so back to sexual function just for a moment, because I know it's February and Valentine's Day is coming, and maybe if you've got a partner, maybe you're going to participate in some sexual activity. I want you to know that the pelvic floor muscles play a large role in the ability to enjoy intercourse. So if you are a male or female and you're having pain with sex, please see a pelvic floor physical therapist. Sex shouldn't be painful unless that's your thing and you have consent, and by all means, go for it. But if you're trying to have sex and it's painful and you don't like it, address it right away. It could be a sign of pelvic floor muscle dysfunction. It could also be a sign of some hormonal imbalance in your tissues. So the other thing that happens with pelvic floor muscle dysfunction and sex is sometimes more women than men. Women say like, I don't really feel anything. And that's also not enjoyable. So if you're having sex that's painful or just not enjoyable, your brain is going to stop wanting to do that, and your libido is going to drop, and then you're going to have less intercourse, and then it's going to affect your relationships, and so on and so on and so on. So if you're having painful or not so great intercourse, see a pelvic floor physical therapist, please. Okay, moving on from pelvic floor anatomy and a little bit from sex, let's talk about stress urinary incontinence. So stress urinary incontinence is leaking a little bit of urine when you cough, laugh, sneeze, run, jump, exercise. It's caused by high pressure on the bladder. So it's high intra-abdominal pressure pushing down on the bladder, which allows a little urine to escape, and then maybe the muscles don't catch it. So that is what is probably happening in Pom Squad fitness classes if you're peeing a little bit during class. Okay, so what causes this problem? Okay, so like I mentioned, high intra-abdominal pressure. Also, pelvic floor muscle dysfunction. Pelvic floor muscles need, just like every other muscle in your body, they need strength, they need endurance, they need coordination, and especially these muscles, along with your core, they need to anticipate your activity. So they need to know you're going to cough, laugh, sneeze, jump, step to the left, step to the right. These muscles need to anticipate that activity for you. If they don't, by the time they contract, it's too late. The pressure has already happened and urine has already escaped, and you peed a little bit in your pants. So we need to talk about pelvic floor muscle dysfunction and what we can do about it. I'm going to come back to that at the end, but that is one thing that can contribute to stress urinary incontinence. Also, pelvic organ prolapse. So this is more common in women. It's more common in women who have been pregnant and had a delivery, but it's vaginal delivery, possibly also C-section. This is when your pelvic organs change position, and most of the time it's a change in position where the bladder or the uterus or the rectum drop into the vaginal canal. This change in position compromises how the organs distribute pressure and absorb pressure, and that also contributes to stress urinary incontinence. Let's see, what else? The container itself. So we're talking about the abdomen, the pelvic floor itself. If you have a DRA, a diastasis recti, that looks like a split at the abdomen. So like it's like an opening between your abdominal muscles in the abdomen. You might notice when you try to sit up, you might notice a dome that happens at the abdomen. That's called a DRA. And basically your container is compromised, and that's going to change the pressures as well. So if you have a DRA, it could contribute to stress urinary incontinence. Okay, so you're peeing a little bit in Pom Squad fitness classes. What can you do? Well, let's start with some basics, and then we'll get into the technical stuff. So one thing I want you to be aware of is your anatomy. So here is a pelvis. I'll try to get a little closer. Right, so here is a pelvis. Here is rectum, uterus, bladder. If you have a history of constipation, we need to get that under control. As you can see where the rectum lives, if the rectum's full of stool and it's putting pressure onto the uterus, that's going to put pressure onto the bladder, and you're going to be leaking urine. You have to be emptying your bowels. If you're like, Renee, I've never been regular my whole life, what's the big deal? If you want to stop peeing, we need to figure out how to help you empty your bowel daily. That might be a change in diet. You might need a fiber supplement. You might need a magnesium supplement if that's okay for your body. So just know constipation is associated with stress urinary incontinence. What else? Breathing. If you're exercising in class and you're realizing that you're holding your breath, that's adding intra-abdominal pressure onto the bladder besides the jumping and the kicking and the prancing. So breathe. You also might try a little breathing exercise. So I want to save that when we talk about pelvic floor muscle dysfunction. So I'm coming back to breathing and pelvic floor muscles in a moment. Also, I'm going to talk about another little breathing technique called hypopressives. This is a technique you would need some training in, but it's a way to breathe that creates low pressure in the abdomen. It inspires the core and the pelvic floor muscles to react in an anticipatory way, and it can perk up those muscles. So we'll come back to that. If you have pelvic organ prolapse, if you, what might you feel? You might feel like heaviness in the pelvis or like a pressure. You might even feel like when you wipe or if you have intercourse, you might feel like a bulge into the vaginal canal. That could be like the bladder kind of dropping into the vaginal canal. If that's happening, you need some support. So your pelvic floor muscles support your organs from below. If they're dysfunctional, they might be letting you down. There are devices that exist, and I want to mention them. Either they work or they don't. There's an over-the-counter device called an Impressa, and it's almost like a little device that you insert like a tampon. It is not a tampon. It does not absorb urine or menstrual fluid. It simply supports the urethra and the bladder. Sometimes that's enough to take care of women's stress urinary incontinence. So that's an over-the-counter device. If that isn't enough, so like I mentioned, either for some women, like they try it and it works and it's great, otherwise it doesn't work at all. There's also a device called a pessary, and that is something that's fit by a doctor, an MD, not a physical therapist, and it's a device that you wear inside the vaginal canal that also lifts the organs, and that can take care of stress urinary incontinence due to pelvic organ prolapse. Okay. Also, there are some support garments you can wear. It's like basically a pair of compression shorts or leggings that will put a little extra pressure around the bladder, around the pelvis, and maybe take some pressure off so that you leak less. Okay. I'll provide info about those products as well. And at the very least, if you're leaking during a Pom Squad fitness class, at least use the right pad. Use a urinary incontinence pad. Menstrual pads are not designed to absorb urine, and you're probably going to make a mess. So just bite the bullet, buy a panty liner, thin poise pad that's designed for urine versus menstrual fluid. Okay, back to pelvic floor muscle dysfunction. Like I mentioned, pelvic floor muscles need to contract, they need to relax, they need strength, they need endurance, and they need coordination. They don't always work at 100% and then 0, 100% and then 0. Sometimes they need to work 30, 70, 40, 50, 60, 0. Like they're constantly modulating their activity. So we need the right activity from these muscles. That is why I am not recommending Kegels for stress urinary incontinence. Without me doing an assessment on you, I don't know if you have pelvic floor muscle dysfunction, where maybe some muscles are tight, some muscles are weak, and that's what's happening. If your muscles are tense, I do not want you doing Kegels. It's not going to help. So I don't recommend Kegels without an assessment. If you came in and truly your problem was weakness, there we go. If you come in to a pelvic floor muscle specialist and we assess your pelvic floor muscle function, which is done through the vaginal canal or the rectum for men, if we find that your muscles are too tense, even if it's not everywhere, if it's just on one side, we have to help them relax before we start exercising them. So a lot of times as a physical therapist, the first thing I'm doing with people is teaching them how to relax their pelvic floor muscles. All right. Let's say you want to try something at home to help. Like I mentioned, I think the safest thing you could try at home is breathing. So while you're doing your Pom Squad fitness classes, make sure you're breathing. Don't hold your breath. Don't wear a sports bra that's tight and wraps around your rib cage. Breathe. If you want to try a little breathing activity to see if you can get things engaged, you might do this in a laying down position. Take a normal breath in. On your exhale, draw your belly button towards your spine and zip up your lower abdominals like you were zipping up a tight pair of jeans. On your next breath, try to maintain that and take a breath. You'll have to move your rib cage. And on your exhale, maintain belly button towards the spine, zipping up the lower abdomen like you're zipping up a tight pair of jeans. So you need to be able to maintain that activity while you breathe. In order to maintain that activity, you'll have to move your rib cage to breathe. That brings me back to hypopressives. I love hypopressives. They're used all over the world, very little in the US. Basically, it's a breathing technique. Pilates also uses a rib cage breathing technique that it moves the rib cage. It allows the abdominals, the core, the pelvic floor to engage automatically and start functioning more normally so that they can anticipate your actions, they can anticipate pressures, and the breathing will disperse the pressures from the abdomen and the pelvis away from the bladder. So it's a lovely technique, and I will share more info about that as well. Okay, moral of the story is though, if you're having stress urinary incontinence, there is something you can do about it. And if at all possible, please see a pelvic floor muscle specialist. So I'm in the Chicago suburbs. I work at a clinic called the Kirk Center for Healthy Living. You would come in, you would see me for an hour. We would do a pelvic floor muscle assessment. We may assess your pelvic organ positions, and then we would go from there. If you need to relax, we would teach your muscles how to relax. If you need strength, we would train for strength. If you need endurance, we would train for endurance. If you need coordination, we would train for coordination. We would train for what your body specifically needs. So it's really the best way to do it. If you're like, Renee, I don't really have access to a physical therapist, or maybe I could do one visit here and there, do it. If you need to, tell your pelvic floor physical therapist. If you come in and say, you know what, look, I'm here because I leak urine when I exercise. I'm not going to be able to attend regular visits. Can you show me some things to do at home to try to make some progress? Be very open and clear with what your goals are and what you want from your physical therapist. If you're seeing a physical therapist and you're not getting the results you want, find a different one. If you need help, let me know. Different physical therapists have different techniques. For example, my specialty is hypopressives. It's also visceral manipulation, which helps the pelvic organs reposition and move differently to help disperse pressures better. It also can close the DRA. So if you're not getting the results you see with your physical therapist, find another one and see if you can get some better results. Just be open and honest about how much time you have, how many visits you think you can attend. In a perfect world, I see my patients for 1 hour, once a week, for about 8 to 12 visits. That's 2 or 3 months. Usually people get some good results if they can participate fully. Some people need less time. Some people need more. Some people I see weekly, some people I see once a month. So whatever you can do to help yourself, but please don't wait. The one thing I hear from women, specifically women, is I'll say, how long have you had these symptoms? And they'll say, well, you know, my oldest is 13, so I guess 13 years. And I'm like, I wish I could have seen you 13 years ago. We could have taken care of this much faster and much better. So if you're having symptoms now, and please, if you've recently been pregnant or delivered a child, get yourself into pelvic floor physical therapy if at all possible. In other countries, especially like Europe, every woman who delivers a baby gets a referral to pelvic floor physical therapy automatically. You shouldn't even have to ask. But if you do, refer yourself to physical therapy. Take care of your body before you have symptoms, and you'll have much better results after. So like I mentioned, I am just passionate about this subject. Also, like I mentioned, stress urinary incontinence usually affects women. On the male side, I see men as well. Usually, if men are leaking urine, it's after prostate cancer. So if they've had treatment with chemo, or if they've had to have surgery to remove the prostate, that does cause urinary incontinence after treatment for prostate cancer. Other things that men may experience if you've had prostatitis or pelvic pain. Prostatitis is an infection of the prostate, but a lot of times there's no infection at all. It's pelvic floor muscle dysfunction that's a problem. So if you have any chronic prostatitis, see a pelvic floor physical therapist. The urinary symptoms I see in younger men usually are more like urinary hesitancy, so trouble initiating urination, trouble emptying, so like retention of urine, or post-void dribble, so peeing and then walking away and dribbling afterwards. So again, for men, maybe you're not leaking during class, but if you have any of those symptoms, you might be having pelvic floor muscle dysfunction, and you would benefit from some pelvic floor therapy as well. All right, I could go on and on about this subject. I am happy to answer any questions you have. I hope this was helpful, and I will see you soon for more self-care techniques. Thanks, and have a great February.